Welcome to Final BDS Me DC. In this video, we are going to discuss the one-marker questions from the subject of pediatric and preventive dentistry. First question is primate spaces. These exist between the maxillary lateral incisor and the canines. They are present mesial to the maxillary deciduous canines and mandibular canines and first deciduous molars. That is, they are present distal to the mandibular deciduous canines. These spaces are also called anthropoid or simian spaces as they were initially found in our ancestral simian species. Two is define subjective and objective fear. Objective fears are those produced by direct physical stimulation of the sense organs and are generally not of parental origin. They are responses to stimuli that are felt, seen, heard, smelled, or tasted and are of a disagreeable or unpleasant nature. Subjective fears are those based on feelings and attitudes that have been suggested to the child by others about him without the child having had the experience personally. Question 3 is celluloid strip crowns. Celluloid strip crowns are pre-formed transparent plastic shells used in pediatric dentistry to restore primary anterior teeth. They are filled with composite resin and then placed over the prepared tooth to create an aesthetic restoration, particularly useful in cases of extensive caries or trauma. 4 is salivary buffers. Salivary buffers include specific components like bicarbonate, phosphate, and proteins such as histatins and statherins which help neutralize acids in the mouth and maintain oral pH. Question 5 is Buckley's formocresol. It is a medicament used for pulpotomy procedures. Its composition includes formaldehyde 19%, cresol 35%, glycerine 15%, and water 31%. Question 6 is critical pH. It is the pH level below which demineralization of tooth enamel occurs. For dental enamel, the critical pH is approximately 5.5 to 5.2. Question 7. Define soldering and welding. Soldering is a process of joining two or more metal components by melting and flowing a filler metal into the joint, typically at a temperature below 450 degrees Celsius. Whereas welding is the process during which a portion of the metal being joined is melted and flowed together. What is fusion and gemination? Fusion is a dental anomaly where two adjacent tooth germs unite during development, resulting in a single large tooth structure. It occurs due to the partial or complete union of two separate tooth buds. Gemination is another dental anomaly where a single tooth germ attempts to divide, resulting in the formation of two separate crowns, which may or may not be completely divided at the roots. 9. What are Epstein pearls and bone nodules? Epstein pearls are small cystic lesions collected linearly along the midline of the palate or median palatal raphe, probably derived from epithelial cells entrapped during fusion of palatine shelves. They are considered a normal finding and typically resolve on their own without treatment. Bone nodules. These are small keratin-filled cysts usually found at the junction of the hard and soft palate. They are remnants of minor salivary glands and are also considered a normal variant in newborns. Question 10. Write the age for mixed dentition growth spurt. The growth spurt during the mixed dentition phase typically occurs around 8 to 11 years of age in boys and 7 to 9 years of age in girls. The most common cause for failure of calcium hydroxide pulpotomy in deciduous teeth. When used in primary teeth with hyperemic pulp, calcium hydroxide comes in contact with some vital pulp tissue remnants and can trigger the cascade of inflammatory root resorption. 12. What is the time period for first window of infectivity? Based on Caulfield in 1993, the window of infectivity for mutant streptococci in deciduous teeth occurs between 7 to 31 months of age. During this period, as primary teeth erupt into the oral cavity, they provide a new environment free from competing indigenous bacteria. This facilitates the colonization of mutant streptococci, which establishes itself in the oral cavity. After this window period, the colonization of mutant streptococci becomes more challenging, as the bacteria would need to compete with established indigenous bacteria already present in the oral environment. Question 13. Write drug dosage calculation formula according to the age and weight of the patient. So first one is Clark's rule. This is based upon the relative weight of the child as compared with the weight of the average adult. The average weight of the adult is taken to be 150 pounds. The rule is to divide the weight of the child in pounds by the average weight of the adult, that is 150, and to take this fraction of the adult dose. Then Young's rule is based upon the age of the child regardless of the weight. It is to divide the age of the child by the age plus 12, and the resulting fraction is the portion of the adult dose which is to be used. According to Tweed, what should be the sequence of serial extraction? So first at 8 years, all first deciduous molars are extracted. Maintain the deciduous canine to retard the eruption of permanent canines. Then after 4 to 10 months, extract all 4 erupting first premolar teeth along with all 4 deciduous canines. And so canines and incisors will be aligned. So the sequence is D4C. What are 4 film radiographic surveys for child? Maxillary and mandibular anterior occlusal radiographs and 2 posterior bite-wing radiographs. 16. What is rooting reflex? When the infant's cheek contacts the mother's breast, the baby's mouth results in vigorous sucking movements resulting in the baby rooting for milk. When corner of the mouth is touched, the lower lip is lowered, the tongue moves towards the point stimulated. When the finger slides away, the head turns to follow it, and when the center of upper lip is stimulated, the lip elevates. Onset of rooting reflex is 28 weeks of intrauterine life. It is well established in 32 to 34 weeks of intrauterine life, and it disappears within 3 to 4 months. The rooting or surge reflex is present in normal full-term babies. So in short, when the baby's cheek contacts the mother's breast or other part, he roots for milk. It enables him to find the nipple without his being directed to it. So that's it. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel and press the bell icon for more regular updates.